My name's Darius Haghighat. I am a second-year genetic counseling student at Boston University.
And my name is Dani Temares. I'm a second-year genetic counseling student at Columbia University.
Today, we'll be talking to you a little bit about what genetic counseling is, how you can partner with genetic counselors in your care for von Hippel-Lindau, and hopefully answer some questions you might have about genetics in general. So first off, one question that we get a lot is, what is genetic counseling? So we've shared the definition by NSGC, which is the National Society for Genetic Counselors. Genetic counselors have advanced training in medical genetics and counseling to guide and support patients seeking more information about how inherited diseases and conditions might affect them or their families, and to interpret genetic test results based on your personal and family history. So why are we talking about genetics in the first place? We can kind of go through a really quick genetics crash course. So to the left, we've got a picture of DNA, and to the right, a picture of an instruction manual. And that's because I like to think of DNA as the instruction manual for our bodies. So we get one copy of our DNA from both parents. So we got two copies for most of the genes in our body. And occasionally there can be spelling changes that come up in those genes that affect the way that we read the instruction manual. And those spelling changes can impact our health. And one example of that are variants in the gene responsible for von Hippel-Lindau. So because that has a really strong genetic component, it's one important factor of that is seeking care with a genetic counselor or a medical geneticist. So when it comes to genetic counseling training, genetic counselors receive a master's degree that focuses on human genetics as well as counseling psychology. Our training also involves fieldwork at clinical and non-clinical sites, as well as producing a research capstone or a thesis. So all of this typically takes about 2 years of really specialized training focused on this genetics area of healthcare. And genetic counselors can work in a variety of different settings. Some of the more common ones that you'll hear about are prenatal care for pregnant patients, pediatric care, as well as cancer care. And that's where we typically see our patients who have von Hippel-Lindau. But you can encounter genetic counselors in a variety of other settings, such as cardiology and neurology, as well as outside of clinical settings altogether. For example, working at genetic testing labs, working in research focused on rare disease, and doing a lot of advocacy work. So the skill set that genetic counselors possess kind of make them really uniquely situated to do that kind of work. A part of our training really focuses on the psychosocial aspect of genetic conditions. So we understand that there can be a good deal of anxiety, stress, fear, guilt, shame, all of those things come up a lot when we're talking to our patients. And so it's important that we get training on being able to address those feelings and help our patients work through those things. We also get obviously very specialized training on genetics itself, as well as science communication. So we're able to explain some of these complex topics to our patients and make sure that you possess all of the facts and the information that you need to make informed decisions about your own care. We get specific training on certain tumor predisposition conditions. Von Hippel-Lindau falls under that category. And as a part of that, we get a lot of familiarity with screening guidelines, surveillance, and kind of next steps after receiving a diagnosis. So now I'll hand it off to Dani to talk a little bit more about the specifics of working with VHL patients.
Yeah, so within our training, we really do have a focus on rare diseases. And the definition of a rare disease is any disease that affects fewer than 200,000 people in the US. So I'm sure it's not surprising to you guys that VHL is a rare disease. And there are approximately 7,000 known rare diseases. So while one rare disease on its own is rare, collectively, rare diseases aren't so rare. They affect about 1 in 10 Americans. So about 10% of Americans do have a rare disease. And approximately 80% of rare diseases do have a genetic cause, of course, VHL being one of those, which is why in our training, we have a specific focus on learning about rare diseases. So right now I'm in my VHL clinic at Columbia University. And so we see patients on a first-time basis and then have an ongoing relationship with them. So some of you may have already had a first-time genetic counseling appointment with a genetic counselor and a medical geneticist. But if you have not, this is what it might look like. And this could be different whether or not you've already had a clinical diagnosis of VHL or if you're in the process of seeing if you have a diagnosis of VHL. So first, what goes on is something we call contracting. And what that is really just chatting with the genetic counselor about what is most important to you and what you're hoping to get out of that genetic counseling session that day. And so we spend about an hour with each patient. So you don't have to worry about rushing, like with I know a lot of other doctor's appointments can feel that way. So really just take your time and tell them what's most important to you. Then the genetic counsel will gather some of your medical history and your family history of cancers and tumors. So if it's possible, you can try and collect some of that family history information prior to your first meeting with a genetic counselor. So again, we know it's not possible. Not everybody has relationships with their family. Not everybody knows this information. It's not always talked about, cancer in a family. But if it's possible, ask around, see if anybody else has had certain cancers or any tumors in your family when they've been diagnosed. And if anybody else has a diagnosis of VHL, if it's possible to get a copy of their genetic testing report. And then once the genetic counselor asks you all those questions about your medical history and family history, they'll make what we call a risk assessment. So that's seeing if we think it's likely that you have a genetic diagnosis of VHL and what genetic testing we could do to look for a genetic change in the VHL gene and discuss those risks and benefits of genetic testing. And now we can do that genetic testing on a saliva sample or a blood sample. So if you don't want to get, pricked again with a needle, we can do that easily with a saliva sample. So then if you then test positive and have a genetic diagnosis of VHL, you'll have an ongoing partnership with a genetic counselor and the medical geneticist in the genetics department in hopefully a VHL comprehensive care center. And so what that would look like is you would have an annual appointment with the genetic counselor. And again, those annual appointments can take as long as an hour, so no rushes in those appointments as well. And we'll check in on any health updates that you've had in the past year, what's been going on with your health. And we'll also check in on what surveillance you've done in the past year and see if you're due for any surveillance, because we know, unfortunately, with VHL, there's a lot that you have to remember. And so we're there to help remember that. You don't have to remember it on your own. And we can help coordinate that surveillance and make appointments with different doctors that you need to see, and certain imaging that you're due for. We can help authorize that with insurance companies. So if you're due for your MRI of your abdomen, we can help you get that authorized through your insurance company and then help schedule that. Other ways genetic counselors are starting to work with insurance is actually with Welireg and Belzutifan in the US. And so at Columbia, we're helping to coordinate that authorization through insurance companies. So that is a little bit about what an ongoing relationship with a genetic counselor would look like. And if you want to find your own genetic counselor, this is a great tool through the National Society of Genetic Counselors. You can type in "find a genetic counselor, NSGC" in Google, and they can help find you a genetic counselor that's close to your home. So thank you for listening, and we hope we answered some questions. And if we didn't answer all your questions, we definitely recommend you set up an appointment with your own genetic counselor to help you in any way that we can.